Come back from that musical interlude. We brought you gospel music that will uplift your soul back to back to back. In the background is Messi Chinwo featuring Judy K, and we call this one More Than Gold. Well, More Than Gold is our experience we are going to have right now with a medical doctor in the person of Dr. Seto Abra Nogbe, who shed more light on the conversation that has gone global, usually in the month of October. Well, in the month of October, the whole world goes pink just to, create more awareness and advocacy for breast cancer. And shockingly, if you follow the World Health Organization, about 1.38 million new cases are recorded every year globally. Cancer, and about 480,000 people lose their lives every year from breast cancer. That is alarming, isn't it? And so I am glad that right from the 1st of October to the last day in October, there's that aggression to talk more about breast cancer, to educate our women to go and test. Early detection, they say, is very key. Early detection, they say, is very key. But whom am I? As one party chairman will say, whom am I to talk more? I am not worthy, as John the Baptist said in the Bible. But of course, I've got a professional who shed more light on it and tell us all we need to know about breast cancer awareness. And so let me say a very big welcome and good afternoon to Dr. Seto Abranogbe. She is a medical doctor with the Vodafone Health Life Center. Good afternoon, madam, and welcome to 31 Status right here on TCA Radio. Hello, can you hear me? All right, welcome to our show.
Thank you so much.
All right, so let's zoom straight into our conversation for today. We are talking breast cancer, early detection, and of course, early treatment we know will save lives. Now tell us, why did we decide, or why did the world decide to dedicate a month of October to celebrate breast cancer awareness, so we can start off the conversation properly?
So the month of October, as we all know, is Pink October, or what has been dedicated as Breast Cancer Awareness Month. It is because this has become very alarming, and it is taken away, and it is actually becoming a conversation that should be talked about. So the month of October was set aside for discussion on the pros and the cons of breast cancer, more cons than pros. Though early detection, like you already said rightly, is key.
Well, tell us more about breast cancer. What is it? We know it's a cancer that affects the breast. Literally, that's what it means, but there's more to it. Tell us.
Said breast cancer, a cancer that affects the breast. So one may want to know what a cancer is. And a cancer basically refers to any the disease is characterized by the development of abnormal cells that divide uncontrollably and have the ability to infiltrate other body tissues, and to multiply to destroy them. So basically, that's what a cancer is. So this particular cancer affects the breast, the tissues of the breast, and that's what breast cancer.
Well, if you read what the World Health Organization has said, we can't pinpoint exactly what the causes are. How true is that, and how is that possible? Why can't we pinpoint, what causes breast cancer?
Yes, so like you said, you can't actually pinpoint the exact cause of breast cancer, but we can say that there are genetics. And it's multifactorial, genetic and environmental factors that cause breast cancer. So there are what we call risk factors. There are things that make people receptive, or they make people more vulnerable to developing breast cancer later in life. So among some of these risk factors, we can talk about being a female. Like I said earlier, affects more females, but rarely affect males as well. So what makes you more vulnerable in developing breast cancer later in life is just the fact that you're a female, because more females develop breast cancer than males. Also, there's what we call obesity.
Yeah.
It means that you're what a lay person will call overweight. It means that your body mass index is more than normal. You're probably bigger than your height. Your weight is too much against your height. So yes, that's what we call obesity. It's also a risk factor. Another risk factor is sedentary lifestyle. It means that you don't exercise, you lazy about, to put it in layman's language. So this is also a risk factor. These are some of the things that make you more vulnerable to developing breast cancer. Also, as what we call hormone treatment therapy as well is a risk factor. And family history, like I said, it's multifactorial. So domestic factors and environmental factors. So if you have a family history of breast cancer, which means that there is somebody in your family that has ever developed breast cancer, likely to develop breast cancer as compared to somebody whose family doesn't have traces of breast cancer. Another risk factor we can talk about early menopause. That means when you have your menses at a very early age, you're probably more susceptible to developing this. And obviously, if you've had a breast cancer before in one of your breasts, you are likely to develop breast cancer in the other breast as compared to somebody who hasn't had before. So these are some of the risk factors. Late death, what we call ionization radiation, is also a risk factor. So if you're exposed to radiation, then you're probably at high risk of developing breast cancer.
Interesting, points there. And whilst you were talking, I was thinking, hey, have I been doing all of these things? Am I living this? Can you hear me, Doc? All right. So I was saying, as you were talking, I was just, pondering over my lifestyle and asking myself, am I living a sedentary lifestyle? Do I have a family history of, breast cancer? I was just having some sort of introspection as you were talking. But, let's still stay on the issue of some of the risk factors. You made mention of a person who has her menses at an early stage is more susceptible or, predisposed to, Mm-hmm. 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 Let's okay. Let's stay on the issue of diet. Does diet come to play when it comes to breast cancer? What does diet do to the development of breast cancer? Are there some foods that predisposes you to breast cancer? Some foods.
Can you please speak?
Can you hear me, Doc? Yes, sorry about that. We lost you for a few seconds. So I was asking if there are some diets or some foods that we eat that dispose us to, breast cancer.
Like I was saying, there are risk factors, and some of these risk factors are the ones that I have actually mentioned.
Okay.
Dietary factors.
Mm-hmm.
Yes, there are dietary factors that will improve your immunity, but doesn't necessarily mean that it exposes you to breast cancer.
Okay. Can you share with us some myths associated with breast cancer? Because, there are some people, as women, we know there are different types of braziers and all in them and whatsoever. What's the correlation? Share with us some of the myths when it comes to breast cancer.
So first and foremost, the most important thing you should know is that breast cancer is not a death sentence.
Mm-hmm.
Somebody being diagnosed with breast cancer does not necessarily mean that going to die. Okay, that's why early detection is. So that's what I mean.
Okay.
That's why early detection is very key.
Mm-hmm.
Another myth is that if they don't have a family history of breast cancer, then they do develop breast cancer. That's not true either.
Mm-hmm. Okay.
And because we are patients of it. So the fact that we don't, like I said, these are risk factors and they only increase your chances of getting it. That doesn't necessarily mean that the person who has not had a family history cannot develop breast cancer. So that's a myth as well.
Mm-hmm. Mm-hmm.
Then another thing I want to talk about the myth of breast cancer. There is so people actually misinterpret the risk factors.
Mhm.
The risk factors is just the probability, what increases your probability of developing the condition, but not necessarily saying that the fact that these risk factors are not present you like totally safe.
Mhm.
So some people say if you maintain a healthy weight, exercise regularly, eat healthy, and limit alcohol, you don't have to worry about breast cancer on you as well. But like you rightly said from the beginning, nobody actually knows the cause of
Yeah.
breast cancer, but we can only tell you what the risk factors or what could actually increase your probability of developing the condition. So yes, these are some of the myths that surrounding breast cancer. Like you said, wearing a bra can cause breast cancer.
Yeah.
Actually, there is no evidence that bra causes breast cancer.
Mm. Mm.
But obviously, time you want to reduce the coverage. You want to reduce how tight things, the type of things that you there's really no evidence that says that wearing a bra actually causes breast cancer.
Yeah. Yeah.
Another myth is that using an antidepressant can cause breast cancer. But the
Mm.
fact is that there is also no evidence of connection between an under antidepressant and breast cancer.
Mhm.
But then again, it's still being studied. The safety of antidepressants are still being studied.
Mhm. Mhm. Okay.
Another myth to talk about is that carrying your cell phone in your bra can cause breast cancer. Again, there is no evidence of connection between cell phones and breast cancer.
Mhm.
But
Interesting.
then cell phones will also still be studied
Mhm.
because obviously the phones actually take out radiation. But then there's actually no evidence of the connection between cell phones and breast cancer.
Okay.
Okay, there's another myth that says consuming too much sugar causes breast cancer. The fact is that there's no sugar in diet can cause breast cancer. So earlier on, you were asking me about dietary foods that cause breast cancer, and I
Yeah.
was explaining to you that there's really nothing in that regard with breast cancer. So I really emphasize on the risk factor. Just 1 minute remaining. So, so you find people saying that you have a lump in your breast, then you have breast cancer. That is totally untrue as well.
Mm.
The fact that you have a lump in your breast does not necessarily mean that you have cancer. So that's why they would have to do further studies to find out what kind of a lump you have in your breast. It may or may not be a cancer. Check.
Okay. Okay.
Then there's another myth that says that early stage, even with early stage breast cancer, there's always some risk that you retain. So you can't totally rule it out that that.
Yeah.
So yes, there's so many myths, but these are a few that I want to highlight on. You have no call credit in your MTN account. Please.
All right, then. And so we will go back onto the phone lines and talk to Dr. Nogbe, who's shedding more light on breast cancer. And I'm more interested in the myths, that are being peddled around by so many people. I mean, she says all of those things are not scientifically proven. You're still listening to the Christian Avenue radio, and it is 31 Status with me, Pamela Boateng. We're streaming live on our Facebook platform. It is the Christian Avenue radio. We take a quick musical break. And when we come back, we continue with our discussion right here on the show. All right, so welcome back from that quick musical break. We are going on to the phone lines and speak to Dr. Nogbe, who has joined us back on the line. Hello, Doc, and welcome back. We apologize for that quick interruption. All right. And so we were talking about the myths, and I think you've given us more than enough myths we need to just throw away into the sea because, I mean, these are just not accurate enough. Now, let's talk about the symptoms of breast cancer. You know, there are people who don't know when their breasts are becoming sore and cancerous. Tell us what.
The pain. And so, yes, this is some of the these are some of the signs and symptoms. You might find a red fitted skin over your entire breast.
Mhm.
You might find some form of swelling in some part of your breast. You might find some form of nipple discharge, which is not breast milk. So any form of discharge that might come out of your breast, which is not breast milk, and obviously know that a woman will only be lactating when they are having a child, like when they just have their children or they just come out of labor. So if you are not in that phase or completing phase, then any other discharge that will come out of your breast, you might want to have it checked out. Because it might be a sign of breast cancer. Any blood that have blood coming out of your nipples, and you might want to see a physician to check it out as well, because it could be a sign of breast cancer. You might have feeling of scaling, flaking skin on your nipple area. You might probably have an inverted nipple. That means the nipple will go inside out or upside down. You might see a sudden change of size of the breast, and then you might see changes in the appearance of your skin on your breast, what we call the pedorrhea. So the skin begins to look like the peel of an orange. And then you might see a lump under your arm. So the lump is not only about the breast, but it could be under your arm as well. And this could be a sign of breast cancer as well.
Okay. Well, let's stay on the issue of. Yes, I got that, very, very insightful. But let's still stay on the issue of, maybe an increment in your breast size. As women, we have issues with body weight and all of that. We could gain, we could lose, but especially when we gain, we also gain fats, just around our breast area. How do we distinguish between the natural breast fat and then breast cancer?
Earlier on, I said that obesity was actually a risk factor cancer, so you might want to check it. But then again, like I said, there are a series of symptoms that you'll be looking out for. So how do you know the difference? Your breast, when your breast is normal, you might see that it is normal in shape.
Yeah.
Okay. Yeah. So the size and the shape will tell you would actually notice that it's an anomaly. So the size and the shape will change. You heard about the things, and obviously, like I said, you have to learn to are developing some kind of a cancer. So most of the time, you would want to compare the two breasts. Okay?
Yeah.
So you see that you would want to compare the two breasts, one of which is maybe normal and the other one not.
Yeah.
So looking at it, you'll be able to tell that this one's shape and size has changed. And obviously, you had your breast since the day you were born, and it's probably increased in size during the future. So once there's a change, you are normally be able to visualize that just by looking at them.
Yeah. Well, Yeah, I'm here. I'm listening, attentively to what you're saying. Well, as I want you to allay the fears of so many women who think that one breast being bigger than the other means there's some sort of, sickness in, either of the breasts.
Of their body bigger than the other. It's not exactly very normal. But obviously, it shouldn't be a proportion that is so visible.
Yeah.
So, like, obviously, as I'm right-handed, so it's more likely that my right hand will be more active and more bigger than my left side, but it shouldn't be too visible.
Okay.
You get it? It's just like some of them very insignificant.
Mm. What is the Mhm.
And one side is actually really, really big, and the other side is really, really small. And then you begin to visualize that it's a difference. And you might want to see a position and have it show up.
Okay. Well, what is a timeline between the early stages of breast cancer and the deadly stage of breast cancer? What's the timeline? Is it like a month? What's the timeline?
So every individual is different, and every individual will develop it in different stages and at different times in a different period. Like every individual will react to everything. Every the breast cancer differently, and they want to may develop it at different times. I've seen people who have developed breast cancer and have lived for a period of 2 years before even getting to their terminal stage.
Mm-hmm.
However, like I said, and I repeat again, every individual differs. And the problem with breast cancer is that most people actually detect it when they are already in their terminal stage, which is why it is important to have examined from time to time to know if there are any changes in your breast.
Mm-hmm.
So yes, time frame depends on the individual. Yes, I've seen people who have been detected at very late stages and have lived right about 2 years before getting to their terminal stage.
Okay. So there's the early stage and there's the terminal stage. Are there more stages, or these are the only two stages?
Which breast cancer is stage. You
Mm-hmm.
can use what we call the mechanism stage, or you can use the normal stage, which has 5 different stages from stage 1 to 5. So in the TNM stage, you want to see that you're looking at the tumor. TNM simply means tumor, lymph nodes, and metastasis. So we are trying to look at the size of the tumor, how big it is, how big is the lump. Lymph nodes, you want to know whether there has been some kind of spread into the lymph nodes, and metastasis is whether there has been some kind of spread in the other organs, and that is what we call the terminal stage.
Yeah.
When it spread to other organs, so it makes it even more difficult to treat because obviously you're not just dealing with the breast, but you're dealing with other organs.
Mm. Well, mhm.
T1, and you have the tumor smaller than 2 centimeters or up to about 2 centimeters.
Okay.
T2, you have the tumor from 2 centimeters to 5 centimeters. The T3, you have the bigger than 5 centimeters.
Yeah.
And with the last part, which is the T4, you have that the tumor extended to the skin or the chest.
Mm-hmm.
When it comes to the end stages, with the N0, we say that no lymph node metastasis, which means that the tumor has not spread to what we call the lymph node. There has been no spread to the lymph node. And we have the N1, which says that the metastasis is the equilateral movable axillary lymph node. So the lymph node under the armpit that has spread. So then we have the N2, says the metastasis to the equilateral sixth axillary.
Yeah.
Or axillary lymph node. And there's an N3 which says the metastasis to the infraclavicular. So all these are points.
Yeah.
And you need to know what the clavicle is, what the infra means to use the clavicle,
Yeah.
teach about the clavicle,
Yeah.
yes, like that. And then, like I said, with the M stage, which is metastasis, M doesn't mean that there's no metastasis, there hasn't been spread to other organs. That's what we say, metastasis is M0, and M1, there has been distant metastasis, which means that there has been spread of this tumor to other organs. Like I said, that's mostly the terminal stage. It's very difficult to treat it. You're always not dealing with the breast anymore. You're dealing with the breast and other organs. Yeah.
Well, with the issue of the lump, we all have lumps, in our breast, but when does it become alarming?
It is visible when you have a lump. What you feel as a lump is just fatty tissue in your breast. There's not a lump. When you have a lump in your breast, you probably be able to hold it.
Okay.
Yeah. It's not the same as the tissue you are feeling inside your breast. That's the tissue.
Okay. Well, let's talk about. Yes, I do. I do. Had a. Okay. Well, let's talk about treatment. The difference between early treatment and the terminal treatment. Can you run us through that, please?
Cancer treatment mainly depends on the size of the tumor and the stage at which the tumor is at. So I'm quickly going to take you through the general management.
Okay.
So first and foremost, before you even get to the treatment, they would have to have done a mammogram or an ultrasound or breast biopsy to confirm that you actually have the cancer or you actually have breast cancer.
Yeah.
Then from there, there are four major things that they do. What we call it actually do depending on the stage at which the breast cancer is at. You could do what we call chemotherapy. You could do what we call hormone therapy. You could actually apply some medications, especially in the terminal phase, to alleviate pain and to make the patient, give the patient a better quality of life.
Yeah.
Okay. So that's the type of surgeries that they may want to do. What we call the lumpectomy, or they could just taking out the lump, or they could do what we call a mastectomy, which means they take out the whole breast.
Okay. Yeah.
And they could do radiation therapy as well on the hormone treatment. So when the disease has gotten to stage 1, and usually they want to do a surgery, one more therapy that is recommended. So with the surgery, like I already said, they could do a lumpectomy or a mastectomy, and they could decide to add a radiation therapy or chemotherapy to it. So with the stage 2, mostly they'll do surgery, chemotherapy, and any other of the two, either a targeted therapy, radiation therapy, or hormone treatment.
Well,
I'm not going to go to the surgery there because I mentioned them either a lumpectomy or a mastectomy.
Okay.
So with stage 3, usually they're similar to the stage 2. They may want to do a surgery plus chemotherapy plus any of the other two, radiation or hormone therapy treatment.
Yeah.
So like I said, with stage 4, which is usually the last stage or the end stage, where they have different practices, they might not do a surgery anymore, but at that time the tumor has spread to other organs, and obviously we are dealing with more than one organ, which makes surgery almost impossible or very difficult. So they might want to do a chemotherapy, radiation therapy, or the hormone therapy. Okay. Also, they might want to give antidepressants. Like I said, they may want to give other drugs to make the quality of life of the patient better. They might want to give antidepressants. I want to give local anesthesia to reduce the pain that the patient may be going through at that latter stage.
Yeah.
And they might want to give steroids, and drugs in that.
Yeah.
So with the management of breast cancer patients, usually it depends on which stage that the person is at.
Yeah.
Most of the time, like I said, the terminal stage, and most of what they might want to do the chemotherapy, radiation therapy, or hormone therapy.
Okay. Well, if you read a report by the World Health Organization, a majority of patients of breast cancer. Can you hear me, please? Yes. So if you read the report from the World Health Organization on breast cancer, a majority of patients are people from poverty-stricken countries like Africa, and most of these people don't have access to these mammograms to do the scanning, the treatment, and all of that. How costly is the treatment or management of breast cancer?
So yes, if you don't really want to get them, you have to treat it. Okay, that is why we early detection. Obviously, it is very in this part of our world, it may be very expensive to do mammogram or very expensive to even get a treatment for breast cancer and chemotherapy and all of that. So that's why we teach early detection. We do we want to take to get to stage 4 to now start looking for breast cancer. So that's the point. So you want to get to stage 4 to get managed where you can easily be detected at a very early stage where it's still just a lump and have it taken out, and probably if you will have a prophylactic mastectomy, and that's some people do a prophylactic mastectomy. They take out both, they have it the lump in one breast and they take out the other breast and then breast. Would you not prefer to have the thing detected at that early stage and have it removed in form of prophylaxis or some form of preventive measures, and to get to the fourth stage to now be looking for a mammogram? But obviously at that point, then the treatment is pretty much expensive. So in this part of the world, and I'm sure in every part of the world, we teach early detection, because at that point it's easier to manage and less expensive for the patient.
Yeah. The tissue is taking out. Can it relapse? Can you have a relapse of breast cancer? Can it come back again?
It does. But then obviously if it's at a very early stage and the surgery is well done, then it shouldn't come back. So usually what they do is if they do take out the tissue and they see that the lump is cancer, so they want to take out extra lymph nodes and extra. If that is going to affect the lymph nodes, they want to take out the lymph nodes that are affected, or even extra lymph nodes to prevent it from even spreading further.
Yeah.
Or also, there's the option of the mastectomy that I talked about. They want to take out the whole breast, which should prevent it from spreading to other organs.
Yeah. Well,
you find that the surgery is done, that is if it's at a very early stage, and you find it getting other things. Or sometimes as well, like I said, if you have a breast cancer in one breast, then it's a high risk.
There's hair loss, there's what have you. With breast cancer, what are some of the side effects or rippling effect?
Okay, so the effect we are talking about, we're talking about hair loss. It's actually not effect of breast cancer per se. Actually, the effect of the treatment of breast cancer.
Oh.
So especially chemotherapy. So when you're going through breast cancer treatment, that common things that you might want to get, especially chemotherapy, that common things that may occur during that period. And among them, like you rightly said, is hair loss. So you find them losing their hair once they are going through chemo. You find that most of them get tired sometimes. Most of them get tired of fatigue. They are getting tired easily. You find a lot of them now nausea and vomiting.
Yeah.
You find a lot of these cancer patients having nausea and vomiting. You find them having constipation, appetite changes, and you find them having anemia or what we call low blood count. And so yes, these are some of the effects of chemotherapy. Like I said, they are not effects of breast cancer, but they are effects of the treatment of breast cancer, especially chemotherapy.
Yeah. Well, on this show, we'd like to give hope to all ladies, and the picture we have created so far is gloomy and sad, and doom and all of that. But please encourage us, motivate us. What should we do to stay clean from breast cancer? And even if there is some sort of detection, what is the hope? What is the assurance that we are going to live longer? Encourage us this afternoon.
So prevention right now, your best aid at prevention is early detection.
Yeah.
So it's good for you to do your you want to look out for some form of a lump. Like I said, the fact that you have a lump in your breast doesn't necessarily mean that you have a breast cancer. But it's better to detect the lump and have it checked out than not to have it checked out at all, or not knowing that you have a lump. And then you ask about what are the chances. Breast cancer detected early have a very diagnosis. What do I mean by that? You have very good chances of getting better treatment. So to help me earlier on, I said the treatment depends on the state at which you have it. So the less it has progressed, the more it can be contained.
Okay.
So it is better for you to detect it earlier. Like I said earlier, it's better for you to detect it, and once it's detected at an early stage, then your prognosis is actually very good. And you're likely to go through treatment and come out very well. So many people have been diagnosed with breast cancer and have actually gone to treatment therapy of some kind, some radiation therapy of some kind, and they've been just fine. So yes, it's not a death sentence, but you need to know early so that they can actually take steps to help you.
Okay.
At a very early stage.
All right. Okay. Thank you so much for your time and expertise this afternoon, Dr. Seto. We are so grateful, and hopefully one of these days we'll have you in the studios to talk more about health. All right. Thank you so much, and enjoy the rest of your afternoon, madam. All right. So there you have it. We just ended our conversation with Dr. Seto Nogbe. She happens to be a medical doctor with a Vodafone Healthline Center, and she expanded more on the topic of breast cancer. It's more like a cliche, but it needs a lot of awareness and some sort of advocacy. And so we decided to dedicate today's show to the education and join in the world's celebration of Pink October. Yes, the whole of October is dedicated to the awareness, early treatment, and education of breast cancer. And she said so many things, right from early detection to early treatment to the stages, right from the 0 stage to stage 5. She told us about some myths associated with breast cancer and every other thing we need to know when it comes to that. You're still watching 31 Status with me, Pamela Boateng. We are taking a quick musical break. It's coming in from Judy K, and she calls this one Capable God, a very popular song on the lips of almost everyone. And when we come back, we go back onto the phone lines and speak with Dr. Kelvin Owusu on the male factor when it comes to breast cancer. Stay on.
Gigabyte at 20 Ghana cedis on Vodafone. Dial star 700 hash now.
To copy this tune at 20 pesos for 45 days.
Hello? Hello? Hello?